Very pleased to be here. I was invited because I think Paddy knew that if he didn't invite me, I'd probably turn up anyway. So, quick bit of good news. As some of you, I've got to say, this is, I'm going to go talk very, very fast. I always talk fast, but this is a shortened version of a presentation we gave to the committee of the Australian Parliament last week. So, as you probably know, smoking rates in England have been falling steadily, but over the last couple of years have been falling really quite rapidly. This isn't the official data. This is Robert West's Smoking Toolkit survey, which shows pretty much the same thing. But I'm using Robert's data because it also shows you this. The rate at which smokers are quitting successfully has shot up. Now, this was the data back from February, where it was showing that 1 in 4 smokers attempting to quit were quitting successfully. And that's gone down now to a mere 1 in 5. So still 20%, really high rates of quitting, unprecedented. This was a slide I'd written especially for the Australian Parliament. I just wanted to point out that people often say that the UK has a recklessly pro-e-cigarette stance. Far from the truth. Having regulated electronic cigarettes extremely thoroughly, we thought we were managing the risks well enough that we could concentrate on maximizing the opportunities which are undeniable. And if you look at I don't want to boast about all the e-cigarette regulation that we have in the UK, most of which you have also in Ireland. But the difference between Australian vapers and UK vapers is that UK vapers have quality assured and tested products with health warnings on them, and Australians get their vaping products from the black market. Well done, Australia. So where did this idea come from? How did England come to be so strongly advocating tobacco harm reduction? How did we get this sudden rush of blood to the head? Well, we didn't. We'd been talking about this calmly for at least a decade, starting with the RCP's first tobacco harm reduction report 10 years ago, then an ASH-led report, then the National Institute for Clinical Excellence, as it was at the time, NICE, taking a very good line on harm reduction, so well done, NICE. And then ASH following up with another similar report presenting a consensus on tobacco harm reduction, amongst other things, and the RCP doing their second report in 2016. And the 2015 report that Anne McNeil did for PHE was the first one to get the headlines, but actually it was the third report, and we have at least 5 more to come because in the tobacco control plan, PHE are charged with producing another one of these evidence updates every year for the next 5 years. We're really serious about the evidence. And we're looking for evidence, not just that supports our views, but challenges our views. We want to be sure that the kinds of measures that we've adopted have been having the effects that we want and haven't been having unintended harmful consequences. And so we have this partnership with the UK, with Cancer Research UK and the UK Centre for Tobacco and Alcohol Studies. I'm going to pause for a minute on this one because we meet 3 times a year. It's not that far to come over to join us. Usually we meet in London. If you can't do that, at least sign up on the CR UK website for our monthly digest of the latest research. So we look at 8 or 10 topical studies that have been published, and each one is given a kind of critical review by a team of researchers at Stirling. No favour at all for authors involved. They were savage about a paper that I wrote a while back. So what's going on now? This is another piece of work from a collaboration with Linda Bald and Anne McNeil. We've been working with ASH to track UK adult and child vaping rates for the last few years. And the truth about UK vaping among young people in the UK is that there is some experimentation, and that the number of young people who've experimented with e-cigarettes continues to grow slowly. But if you look at that pale blue line at the bottom, those are young people who use e-cigarettes regularly. And by that we mean once a month or more. So not all that regularly, right? So if you use e-cigarettes even once a month, you fall in that 2%. And who are those young people? Well, we know quite a lot about them. They are overwhelmingly young people who already smoke. Indeed, the more you smoke, the more likely you are to vape. And young people who have never smoked have, rarely even vape experimentally. So you can see the figure there for regular vaping among young people who never smoke, 0.2%. That just doesn't leave room for a gateway. And we published these data just in the summer, a couple of weeks after a paper that claimed that they had found evidence of a UK gateway effect. Well, ask me about that later and we can talk about it then. Toxicity is, again, a very important topical issue in regulation. That's why we would regulate. We wouldn't bother regulating if the products weren't toxic. And the early evidence was really quite reassuring. So this is Maciej Gonovich's paper, which found that the levels of toxicants were 9 to 450 times lower than in cigarette smoke. So a fraction of the level. This wasn't a one-off thing. This is a study by Ricardo Pelosa, who found that, so you see on the left-hand side, the products even back then weren't too bad at delivering nicotine. These were early cigarette products, but they were delivering much lower levels of carcinogens. This one is NNAL, which some of you will be familiar with, which is a tobacco-specific carcinogen. And you can see in just 2 weeks, the levels of detectable NNAL fell dramatically. And this was the kind of data that David and I were looking at as part of the NUT paper, where we weren't out trying to find the figure of e-cigarettes versus cigarettes. We wanted to look at the range of nicotine products and what we knew about them at the time on a range of criteria. So, for example, we know that cigarettes are the largest cause of fire deaths in England, cause more fire deaths than everything else put together. We don't know how many fire deaths are caused by nicotine patches. We thought fairly few. So we had to work with what data we had. Anyway, we came up with this figure that e-cigarettes were likely to have at most 5% the risk of other products, looking in the whole range of different risks. So 2017, we had a really good paper, which I'm sure many of you are familiar with, which was a collaboration from Roswell Park in the US and UCL. Again, very like the Pelosa paper I showed you earlier, that looking at a range of nicotine delivery products from cigarettes, combination NRT and cigarettes, NRT on its own and e-cigarettes on its own, all reasonably good at delivering nicotine. E-cigarettes probably better than most, NRT not as good. And then we're looking again, the team looked at a range of carcinogens, but in this case we'll look at NNAL again, just for consistency. And you can see that if you're smoking tobacco, you're getting quite a lot of NNAL, but if you switch to NRT only, it goes much lower, and e-cigarettes lower still. So pause there a minute. E-cigarettes lower NNAL delivery than nicotine replacement therapy licensed medicines. So then another paper came out in the summer, which was again very encouraging, looking at carcinogens, where it found that the cancer load, the cancer potency, was less than 1% of that of tobacco smoke and probably about 10% of heat-not-burn products. Now, the authors recognized that the reduction in risk was probably less big for heart disease and respiratory disease, but nonetheless likely to be substantial. This prompted Stan Glantz to say that you're missing the point. If you're looking at cancer risk and tobacco use, you're missing the point. You should be looking at heart disease and lung disease. Since when was cancer not the proper interest of tobacco policy? I just don't get it. Anyway, the good news is that in the UK, and as I understand in Ireland, all the products are tested before they can come on the market, and they can be removed from the market if they break the regulations. Levels of toxicants are extremely low, except in these 3 areas where they're detectable, but much lower than cigarettes. So what about passive exposure? None of you are vaping in here this afternoon. Thank you very much. I saw some of you vaping outside. You needn't have bothered, because if you look at the top line, you see the level of particulate matter caused by a home where people smoke cigarettes. And the bottom 2 lines, I don't know if you can see the difference between the bottom 2 lines, but one's a home where you can vape, and the other is are homes where you can neither vape nor smoke. So to the naked eye, hardly any difference at all. And indeed, measurably hardly any difference at all. Followed up by another study just last year, looking at IQOS and e-cigarettes, comparing them with hand-rolled and manufactured cigarettes. Big surges in particulate matter. I'm going to run around here. Big surges into particulate matter up here for hand-rolled cigarettes and manufactured cigarettes. Very low increases of particulate matter for both the IQOS product and e-cigarettes. But the really important thing is this is tobacco smoke, right? This is poisonous. This is largely propylene glycol or theatrical mist. So really no known risk at all. And this supported the RCP in their conclusions about e-cigarettes. You should be familiar with that paper. Rattling on now, this was a familiar paper slide to many of you, I'm sure. This is, shows that e-cigarettes have become by far the most popular tobacco product. I'm going to run around again. Quitting method in England. However, this is behavioral sport with medicinal nicotine, the most effective. So the most popular, the most effective. That's a shame, because when you combine the most effective with the most popular, what you get is truly amazing. Those red lines are smokers, are quitters using stop smoking services in England who have gone to their stop smoking service with their e-cigarettes and said, I want to give up smoking. And you can see more successful than any other product. But the really interesting thing here is this is e-cigarettes alone. This is a combination of nicotine replacement therapy and e-cigarettes at the same time. This is one and then the other. And it doesn't say which one and which other. And the important thing there is, I think what we're seeing is people are choosing the thing that works best for them and changing horses in midstream. Because if they start off with e-cigarettes and that's not really working, then their advisor is advising them on something else, or vice versa. And by tailoring support to individuals, surprise, surprise, they're more effective. However, this is the point at which you can say, right, you smart-ass thing, this bastard. What makes you think, so exactly how many people are using those products, this highly successful approach? Well, here's England's shame, 1%. The most effective way that we have of quitting, and 1% of people, not quitting, 1% of people quitting in local stop smoking services, coming to us for quitting support. 99% of them, we're telling them to do something ineffective, or less effective. Okay, so the last thing that really, really bugs me is popcorn lung. So it's not even called popcorn lung, it's popcorn worker's lung. And the reason it's called popcorn worker's lung is because it's a disease that affects popcorn workers, right? So it's caused by diacetyl in the kind of a byproduct in the air from the production of the popcorn and the buttery flavorings. And it's also found in cigarette smoke. Interestingly, cigarettes are not a cause of popcorn lung. We know this, it's in the literature, that in fact, popcorn lung, or bronchiolitis obliterans as it's properly called, is really very rare in smokers. And that's despite the fact, or rather despite that fact, and despite the fact that diacetyl is found 10 times more intense in cigarette smoke, or up to 100 times more intensely in cigarette smoke than in e-cigarette vapor, people still seem to think there's some kind of connection with these very low levels of diacetyl and vaping and popcorn lung. In fact, there have been 2 cases, but as I was preparing the original of this slide, I went quickly on to check my facts, right? So I went on to Google, I typed in popcorn, all right? Expecting the first thing to be sweet or salty. The first thing it suggested to me was popcorn lung, and then popcorn lung and vaping. So we've gone from this idea, the scientific evidence, which is of a minuscule risk, if any, to this massive panic. Deborah Arnott and I, we're still mates, Deborah Arnott, chief executive of ASH in London, we were out at the theatre, and we were standing outside afterwards, and these couple of lads came up to us and asked us for a light for a cigarette. So we all thought this was very, very funny. Our partners thought this was funny. And Deborah's husband, John, says, oh, you want to talk to this one about electronic cigarettes? Have you ever tried electronic cigarettes? And the guy chortled off back to the other side of the road and said, oh no, I don't want to get popcorn lung. So, well done to public health colleagues who have scared smokers into smoking, because that is really what's happening. So you can see this is, again, data from ASH, which shows the perception of the risk, of the idea that e-cigarettes are at least as risky as smoking. or as risky or more risky than smoking. The yellow bars would represent where the Royal College of Physicians are in Public Health England, and that's shrunk from 21% to 13%. But terrifyingly, the pale blue bar represents the people who now think e-cigarettes are at least as dangerous as smoking, and that has quadrupled to 28%. And this matters because smokers who believe that e-cigarettes are at least as harmful as smoking are, surprise, surprise, less likely, significantly less likely to try e-cigarettes. But really, most worryingly, is that they're much, much less likely to switch completely away from smoking. So even if they try e-cigarettes, they're less likely to switch away from smoking. So again, a classic own goal for some public health advocates who are scaring smokers into smoking. So finally, my conclusions, and you could probably have guessed them before I started to speak. The UK has extremely rigorous regulations, but we also have a long history in tobacco harm reduction. We've been thinking about this very hard. UK products are really well tested, and now that we're really confident we're managing the risks effectively, now is the time to make sure that we maximize the opportunities. As far as passive exposure is concerned, little of any risk at all. And so I've got a colleague here from the DH, and we've been really very clear right from the start that with all these regulations, we're going to review them post-implementation because we're going to want to make sure that they're working the way we want them to work. And it's really important for us at PHE and the Department of Health that all our regulations, especially on electronic cigarettes, are doing the job we set out to do. That's it.